Welcome back. This is in continuation of yesterday's discussion on doctors and AI. One of the most common questions that keeps coming up, especially on social media, is will AI replace doctors? Interestingly, this concern is expressed more by non-doctors. Many confidently say that AI will replace doctors, but my view is very clear. AI will not replace doctors. Doctors who use AI will replace those who don't. Because what AI brings is not competition, it is amplification. It is like having a highly knowledgeable assistant working 24/7, an assistant with access to unlimited information, an assistant that can guide you, correct you, and support your decisions. The advantage this creates is enormous. So how do you stay relevant? As I said earlier, specialties where knowledge alone is power will definitely be affected. So you must offer something beyond knowledge. And that is where I use the concept of SEAT. You must always give the patient a seat. S, skills. E, empathy. A, attention. T, time. Let's start with skills. Skills cannot be replaced by AI. Procedural skills, surgery, interventions, even simple procedures like IV lines or central lines. Investigation skills, performing and interpreting tests like Doppler or ultrasound. Clinical examination skills, especially in neurology, where subtle signs, eye movements, and lateralizing deficits matter. And importantly, the skill of dealing with patients. These are human, experience-driven, and invaluable. Now E, empathy. We talk about empathy, but we are never taught how to practice empathy. Empathy is not emotion. It is recognizing and responding to the patient's emotions. A simple statement like, "I understand this delay must have been upsetting for you," can de-escalate anxiety instantly. To practice empathy, remember SAVE. S, support. We will work through this together. A, acknowledge. This has been overwhelming for you. V, validate. Anyone in your situation would feel the same. E, emotion. You seem worried, anxious, low. These take seconds, but they build trust and even reduce consultation time. Next is A, attention. In today's practice, attention is rare. Patients feel doctors are distracted, but for the patient, that moment is everything. Giving attention means being fully present, listening without interruption, making eye contact, pulling a chair and sitting by the side of the bed in an inpatient room. Sometimes, the diagnosis is clear early, but listening completely builds connection. Attention tells the patient, you matter. And finally, T, time. It is not about how much time you have. It is about how you use it. Even a few minutes with full attention and empathy is enough. Without connection, even longer consultations feel inadequate. Time also means allowing questions, clarifying doubts, and ensuring understanding. Because patients remember not what you know, but how well you explained. So when you put it together, skills, empathy, attention, time, that is your seat. So will AI replace doctors? No. AI will be a powerful assistant. But doctors who combine AI with SEAT will be the ones who thrive. In the past, patients came for advice. Then they came for opinions. Now they come with information. In the future, they will come for experience. And that is something only a doctor can provide. If you would like to explore these ideas further, I have written about this in my book, My Name is Not a UHID Number, which is available on Amazon worldwide. I would encourage you to go through it to understand these concepts in greater depth. In the next session, we will take this one step further and explore how to structure this approach using the heart model from Cleveland Clinic. Thank you.